Hi, Dr. Wade here with Physical Therapy and Balance Centers in Louisville. I'm a physical therapist, and today we're talking to you about tennis elbow. You want to know, do you actually have tennis elbow, and then what to do about it? Well, let's first find out, do you have it? Typically, they'll call tennis elbow pain somewhere on the outside of the elbow here. A vague pain. It can be very sharp. It can be throbbing, tight, might interrupt your sleep, but it definitely hurts when you're gripping, pulling, pushing, using your hand in some way. Here's a good test. It's called the third digit test. So this is Isaac, and he's actually a tennis player. But what's interesting is that most people that develop so-called tennis elbow do not play tennis. And typically it's from a gradual overuse or a gradual injury of the elbow. It's not something that happens suddenly. In some cases it is. But here's how you find out, do you have it? Third digit test is a very reliable test. You put your arms straight out in front of you here, extend your fingers. If that hurts, you're already on to something there. Now, you'll want to put pressure down on your third digit, on your middle finger, while you're trying to hold it extended. If that hurts on the outside of the elbow distinctively, thank you, then chances are you probably actually have tennis elbow, also known as lateral epicondylitis. So, there are a few different structures in the area that can be hurting. That's a test for the actual tendon. There's an excellent procedure to help regenerate the tendon, because we now know through research most cases of tennis elbow actually are a degenerative problem in the tendon, not an active inflammation. So when you take a tendon like that that has a degenerative process in it and stimulate a healing process through a procedure called Astym, using special instruments, Astym, and I have a link below where you can learn more about this. You can also find a provider that uses the Astym procedure, A-S-T-Y-M. When you use that procedure over this, it actually permanently changes the condition, not just temporarily, such as with what you probably have learned already. People use ice, heat, they'll use the tennis elbow supports, etc. Those are all cute and they're nice, but not until you get in there and permanently change that tendon will you actually get a lasting result. What's really good about the Astym procedure also is that you can stay active and get reductions in pain and improve your ability while, again, staying active. You don't have to put it in a sling and you don't have to rest it all the time. It actually works better with certain activities, and your therapist can guide you through that. To cover a classic stretch that can help you, meanwhile, until you do want to get that permanent change, put your elbow out straight, arm straight, drop your wrist, gently grab with the other hand, apply a downward force until you feel stretch and pull, and slightly turn it out if you're able to do that, just to where you create a stretch, not pain here, okay? Hold that a good 15 seconds and do it 3 times, at least twice a day. Always get the opinion and the advice of your medical provider before doing any procedures that I recommend, okay? But let's recover something here. This might not be just the tendon. You have a joint in this area too, where you could have a joint problem. You do want to get a good diagnosis before you start taking actions and calling it tennis elbow. You could have a joint problem in the area from something else. You could have pain that comes from your neck. And a quick way to see if that happens, if you sit tall, tilt your neck to the side of pain as far as it goes comfortably. Now, if you feel a familiar pain happen when you tilt your neck over, chances are it's coming from your neck. If you feel any pain up in here, you definitely want to get that checked. Okay, so there's some great tips for you in helping determine if you have tennis elbow and what to do to actually permanently change it. To temporarily manage it, yes, using ice, using heat, counterforce supports are fine, but not until you actually do such a procedure like the Astym procedure will you get a permanent change, okay? So, and even if you do get the pain down by stretching it, maybe using some ice, chances are it can come back unless you change that tissue. So I highly recommend you check out the link below to learn exactly what you can do in order to permanently change your tennis elbow for the better. And I wish you much luck with that. I hope this video has helped you, and I look forward to seeing you in the next one.